A pro-Hamas Islamist group has hijacked visual and audio systems at 4 American and Canadian airports.
The Liberal government's immigration department is advertising Canada's public healthcare system to attract immigrants, despite experts saying health services are already overwhelmed.
BC Premier David Eby has once again admitted that the province's illicit drug decriminalization experiment was a, quote, mistake. Hello Canada, it's Thursday, October 16th, and this is the True North Daily Brief. I'm Cosmin Dzsurdzsa.
I'm Alex Zoltan.
We've got you covered with all the news you need to know. Let's discuss the top stories of the day and the True North exclusives you won't hear anywhere else. A pro-Hamas Islamist group has taken credit for a series of cyber attacks at 2 BC airports and others in the U.S. Display and speaker systems were hijacked at Kelowna International Airport on Tuesday night at around 5:15 p.m., displaying, quote, unauthorized pro-Hamas messaging on the airport's flight information display screens. At the same time, Arabic chants played over the airport's public address speakers for several minutes. Spectators reported hearing Arabic chants along with chants of Free Palestine and Trump repeatedly for about 2 minutes. Flight info screens displayed the message, quote, hacked by Mutarif Cyber Islam, and read, Israel lost the war, Hamas won the war honorably, you are a pig, Donald Trump. Kelowna International Airport released a statement at 10:30 p.m. confirming that the incident was limited to a, quote, cloud-based third-party software provider used by the airport and confirmed with True North that the RCMP and Transport Canada have been contacted. The statement reads, quote, yesterday public displays in our terminal building limited to the flight information display screen and public address system were accessed by a third party to display unauthorized messaging. Our team was able to remove the messaging from systems in the terminal building within a matter of minutes. All affected systems were isolated and verified before being restored late last night. The statement noted that the airport conducted a joint threat assessment with the RCMP and Transport Canada and concluded that the messaging didn't pose a direct threat towards the traveling public. Kelowna International Airport said in a statement, quote, to analyze the root cause, we are continuing to work with the Canadian Centre for Cybersecurity and Transport Canada. Victoria International Airport confirmed with True North that the incident also took place at its airport. The RCMP did not respond to True North's request for comment. So, Alex, I was looking through this morning, and I noticed there was an X account. Viewers of this message were directed to by this pro-Hamas Islamist group. What was posted on the account, and have local politicians responded to this hijacking of airport technology?
So, Cosmin, in terms of the account, the messaging and you were referring to, that account I also visited. It's I think it's called Saber Islam, if I'm pronouncing that correctly. And in terms of the content that it's sharing, I believe it's in Arabic, so I don't really understand any of the actual text message itself. But the videos appear to show Hamas fighters with rocket-propelled grenades and all kinds of other weaponry. It doesn't have a ton of followers. It doesn't seem to be a very large account, but I understand that they're also responsible for similar, I guess you could call them cyber attacks in Turkey and Mexico. I heard even that they did a cyber attack in a pizza restaurant in Mexico. All of this seems really random and strange to me. I'm not sure if you've ever been to the Kelowna airport, but it's a tiny, tiny place. And so I can only imagine how disturbing it would have been to be in that airport terminal when this messaging came up on the screen and all of the Arabic chanting and the epithets towards Donald Trump. The story just seems like incredibly random to me as well, given the small stature of the Kelowna airport. One MLA from BC, Tara Armstrong, who is one of the 2 MLAs representing the newly formed One BC party, she posted on X, Kelowna International Airport's display and PA system were hacked with pro-Hamas messaging, referring to the story that we were just speaking about. As someone with years of experience working in airport ops, this is deeply alarming. And she said this isn't a tech issue, it's a serious safety and security breach. Time for a cybersecurity wake-up call across all airports. I was in between airports when this story came about, and it didn't exactly imbue confidence in me in terms of how safe travel is in Canada at the moment, but that's besides the point.
Hey, Kian Bexty here. Do you know someone, maybe it's you, who wants to start a career in politics, but can't stand the thought of wasting years and years in a lecture hall while some woke professor drones on about gender studies? Well, we found the perfect alternative. Macquarie College's Applied Politics and Public Affairs program. It's a 2-year evening and online program available all across Canada, where you'll actually learn how to run campaigns, organize movements, and push policy in the right direction. Instead of empty theory, you'll complete 3 practicums, real-world placements in your community or with the party that you believe in. That's job-ready experience that opens doors straight into politics. And here's the best part. If you apply with code Juno, or simply tell admissions that Juno News sent you, you'll unlock an exclusive $500 scholarship that is exclusive just for our listeners. We're backing this program because we want more of our audience inside the system, making changes from the inside out. With September and January intakes open now, this is your moment. Visit macamycollege.com or click the link in our show notes to apply.
As Canada's healthcare system buckles under immense strain, the Federal Immigration Department is facing heavy criticism for a digital ad that shamelessly promotes the nation's universal healthcare to migrants. The Immigrations, Refugee and Citizenship Canada post, published Monday on X, invites people to, quote, think about moving to Canada to, quote, learn about healthcare in Canada. It links to a government page explaining how provincial healthcare coverage works. The ad has drawn attention for presenting an optimistic image of a system under serious stress. Conservative immigration critic Michelle Rempel-Garner responded with a sharp rebuke. She wrote, quote, read the room, Lena, addressing Immigration Minister Lena Diab. The ad's timing coincides with Canada recording its worst wait times ever. According to the Fraser Institute's Waiting Your Turn 2024 report, the national median wait time between referral to a specialist and receipt of treatment is roughly 30 weeks, the longest in the survey's history, and a 222% increase over the 9.3-week median in 1993. The Fraser Institute estimated Canadians lost nearly $5.2 billion in wages and productivity in 2024 simply due to wait times for medically necessary care. Many patients experienced worsening conditions, reduced quality of life, or permanent harm. Report authors Bacchus Barua and Mackenzie Moir noted that, quote, as long as lengthy wait times define Canada's healthcare system, patients will continue to pay a price in lost wages and reduced quality of life. So, Cosmin, what are Canadians more broadly saying about the Liberals' Immigration Department's post, and what are some of the criticisms of this move?
I would say most Canadians are pretty frustrated and upset when you see the Liberal government putting out ads flaunting how Canada has a so-called free healthcare system. We all know in reality it's not free. We pay for it as taxpayers, people who have bought into the system their whole lives, hoping that it will, be there for them when they need it the most. But an ad like this basically tells people thinking about moving to Canada to abuse the healthcare system. It's free after all. You can arrive here, claim asylum or refugee status, and you have free healthcare for life. At the same time, wait times are at record highs, and Canadians go into the hospital. A lot of people just leave in the ER room because of the wait times, and they're not even seen by doctors. But part of the pressure on this system goes back all the way to like 2017 to 2018, and it's a direct result of policies implemented by the Liberal government. At the time, Ahmed Hussein was the Liberal immigration minister. He no longer has that role, but he changed a long-standing policy. I think it was around for 40 years that denied entry to immigrants who had high-cost health or social service needs. So that includes people with terminal illnesses, other people who require constant care from social services, etc. They were barred from entry. They didn't meet medical admissibility rules. So under prior governments, people who wanted to come to Canada, immigrants, refugees, asylum seekers, etc., had to prove their health conditions would not cost Canadian taxpayers more than $7,000 per year. That was the inadmissibility target before the change. After the change, the Liberals reversed this policy, implemented a maximum cost to taxpayers of $21,000 a year. Now, I looked at some average healthcare cost estimates for Canadians, and $21,000 a year is about 3 times the average cost a Canadian implements on the healthcare system. So it's astounding, these standards that the Liberals have lowered. And on top of that, they're actually promoting immigration by seniors through their family reunification programs. There's other changes to asylum and immigration rules that the Liberals introduced that essentially bring in more seniors. And we know Canada already has an aging population. A lot of our healthcare is geared towards treating and making sure seniors are comfortable. But these new immigration rules and the changes introduced by the Liberals have made it even worse. It doesn't actually address the healthcare crisis, the lack of staffing, when you're bringing in people who will rely on the healthcare system, an unnecessary amount of people who will rely on that healthcare system for the rest of their life. In what has become a recurring event, BC Premier David Eby has again admitted that British Columbia's radical drug decriminalization experiment was a, quote, mistake. Eby made the comments Tuesday at a news conference in Burnaby alongside Forests Minister Ravi Parmar, United Steelworkers District 3 Director Scott Lunny, and Unifor Western Regional Director Gavin McGarrigle. A reporter asked Eby to elaborate on his previous remarks.
Premier, you recently made some comments around decriminalization and your belief that it was a mistake to bring that forward. Do you have anything that you can expand on that, or why did you feel like that was something that you needed to say publicly?
Yeah, like I've said it a number of times, and you know, the reality and the challenge of the toxic drug crisis is that it's required us to try a number of different approaches to the problem. We want to take down those barriers so people can access drug treatment. So they're able to get the care they need, but not at the expense of downtown cores, not at the expense of our parks, not at the expense of our schoolyards, and the safety of kids or the safety of people at bus stops. So we had to reverse course and ask the government to recriminalize the public use and possession of drugs, illicit drugs. It was necessary to do. And we're pushing ahead with involuntary care for people that can't access care because they either can't or won't ask for it, but they're causing outsized amounts of chaos in our community, as well as continuing to expand treatment beds throughout the province. It's a really hard and challenging issue. We won't always get it right, but my commitment to British Columbians is we treat it very seriously. Every life lost is one life too many. It
has never been clear how decriminalizing street drugs would create a pathway to treatment. Shortly after being sworn in as Premier, one of Eby's first initiatives was to decriminalize possessions of small amounts of certain illicit narcotics, including fentanyl, under a pilot program approved by Health Canada. That policy allowed individuals to possess up to 2.5 grams of drugs such as crack, cocaine, crystal meth, and fentanyl. Alex, you live in BC. What are some of the stats and metrics surrounding overdoses, overdose deaths after the BC NDP government decriminalized drugs?
So, Cosmin, since BC began its drug decriminalization pilot in early 2023, the numbers have definitely, you can say, gone in the wrong direction. It might be helpful for listeners to have an understanding of what the purpose of this so-called decriminalization project was in the first place. The idea was that by removing criminal penalties for small amounts of hard drugs like crack, meth, and heroin, or in some cases even fentanyl, it would free up the criminal justice system and it would reduce stigma, opening up a pathway to recovery. this was kind of fantasy type thinking, and it certainly hasn't panned out the way that they intended. Last year alone, BC recorded more than 2,250 toxic drug deaths, most of those being fentanyl overdoses, one of the highest tolls ever on record. That works out to significantly higher than the rate in Alberta, and 10 times higher than the rate in Saskatchewan, and quite a bit higher than the rate in Ontario as well. In fact, Ontario, which did not, of course, decriminalize hard drugs, saw about 2,200 opioid-related deaths last year, but with a much larger population. And I was also in Ontario recently, and I can say anecdotally from what I saw, they also have, like Vancouver, a very robust drug scene, a lot of drug usage going on there. So to zoom in, the contrast becomes even clearer. If you look at Toronto with a population of Vancouver, they saw roughly 500 overdose deaths in 2023, but Vancouver's numbers are almost on the same scale, despite the city being just a fraction of Toronto's size. So when David Eby calls decriminalization a mistake, I think that he's actually echoing what the data already shows rather than an opinion that this has been a terrible failure. What's incredibly baffling about his comment is that the experiment largely continues. It's a kind of dual experiment between the provincial government and Health Canada, and it's set to continue until pretty much late next year, which I find, again, quite shocking, given that the Premier is already acknowledging that it's a terrible, quote, mistake and has probably cost hundreds, if not thousands of lives. I should add, there has been one change to the policy, which is that you're no longer allowed to do hard drugs in public places like a playground or on a city bus. That actually runs contrary to the original spirit of the program, which was to reduce stigma and thereby reducing overdoses, because the idea was that if people were allowed to use drugs in public, they'd be more likely to overdose in front of others and in the presence of others who could provide life-saving care, such as a Narcan kit. And so, even in terms of the spirit of the original policy, the provincial government appears to be going against it. And I estimate that this will result in even more opioid overdose deaths than the province already has.
That's it for today, folks. Thanks for tuning in. You can stay on top of new episodes every weekday by subscribing to the Daily Brief on iTunes and Spotify. Also, while you're at it, make sure to hit us with a 5-star rating and please leave a review.